Hey everyone, it's Dr. Shalini Gupta at the Dermatology Laser and Vein Center, and today I'm going to talk to you about an amazing laser that offers laser skin resurfacing. We use the Sciton laser, which is a double-headed Erbium YAG laser, and truly it is the Lamborghini of all laser treatments. So if you're really looking for a serious improvement and want to take 10 to 20 years off in just about a week to 9 days, this is the laser for you. There is a bit of recovery time involved, but the results are absolutely fantastic, and I'm so excited to show you some before and after photos of this procedure. But we've been doing laser skin resurfacing for a really long time. It does involve removing an entire layer of skin in a continuous manner, and it helps to rejuvenate and really replenish the collagen and the elastic fibers and remodel all the tissue, give you skin tightening. It's almost like a facelift, but even better because you get an improvement in skin tightening, but also skin quality and texture. Now, of course, there are different degrees of sun damage, and so based on that, we can decide how deep we want to treat into the skin. So if there is lighter sun damage, we might do a procedure with this laser called a micro laser peel, where we're not removing quite as much skin, and then the recovery time is also much less. And with a series of micro laser peels or even a single treatment, patients can see really nice results. But of course, if the damage is deeper, we have much deeper wrinkles and lines, then we will go deeper into the skin and get a more dramatic improvement, but the recovery time will also match that as well. So let me just show you what I mean by resurfacing. Essentially, resurfacing is an ablative technology, and ablative means that it is going to vaporize tissue off the skin. So we can basically use this laser here. This is the handpiece of the laser with the sapphire tip, and the energy is going to come out of here and cause vaporization of the skin. And we can decide how deep we want to go. We can decide if we just want pure ablation or if we want some coagulation, which is going to give us more of an immediate contraction and tightening of the skin as well. So this is in contrast to the fractional lasers, which I have also done a tutorial on before, but today we're just going to talk about the ablative technology. So there are different lasers and different depths that the laser can penetrate to. We can do pure ablation, or we can do ablation with coagulation, where you get a zone of heating and then tightening in the skin along with just the ablation. These are different areas of the skin showing different thicknesses of the skin in those areas. So depending on where the laser is being administered, we're going to choose the right settings that will be appropriate for that area, knowing safely how deep we can go into the skin. For example, the eyelid skin tends to be thinner, maybe even 0.6 millimeters, where other parts of the face, such as around the nose and such, might be thicker at 2 millimeters even. This is showing the different cosmetic units on the face. Typically, I like to treat the entire face and then taper at the jawline so you get a nice uniform appearance. But sometimes patients really just have more of a problem in a specific area, for example, around the mouth or around the eyes, and we can treat those areas keeping in mind where the cosmetic units are located so that that skin will blend in seamlessly and flawlessly with the rest of your skin once everything has healed. This is a video showing the firing of the laser. Now this is using a very small spot size. Usually when we're resurfacing the face, we'll use a larger spot size or vaporize more tissue at one time, but this was a treatment specifically on a patient who had an enlarged nose. He had what's called rhinophyma, and we're just shaving off layers of the tissue in order to remodel that, and I'll show you what that looks like before and after in a few minutes. The other thing with the laser skin resurfacing procedures is that we really want to be cognizant to use this technology in patients who are lighter skinned, because with darker skin it can potentially cause some damage to the melanin or the pigment cells in the upper layers of the skin. So those patients would not be good candidates for a full-on ablative laser like we're talking about today, but those patients can definitely get a fractional laser and get similar results in a safer manner. Of course, the ablative lasers have a much more dramatic effect on the skin, and typically the patients who are lighter skinned tend to get more sun damage, so it works out in terms of patient selection. So this is a patient who had the resurfacing, and this is immediately after, just day 1, and then you can see sort of this wound effect that happens, sort of this crusting, and you really want to keep this crust very nice and soft while it's healing, so you want to lather up with a lot of Vaseline and Aquaphor. Make sure that you are well prepared at home for this procedure, because the next day usually your eyes are going to be really swollen, and then we'll ask you to start doing some soaking of the skin to keep that crust soft, and then very gently sloughing it off with your finger pads only, and you will continue to do that until all of the soft crust comes off. And it's just really important to keep your fingers off of it. Try not to scratch your skin. Sometimes we ask you to wear white cotton gloves, especially at nighttime. When you sleep, you want to sleep up at a little bit of an angle. So truly it creates a wound that takes a bit of recovery, and you need to be mentally prepared for that. But if you are, and if we can get you through this healing time seamlessly, then the results are absolutely worth it and dramatic. This is a patient who had sun damage, and he had what's called a micro laser peel, so a little bit of a shallower treatment. And you can see here after a few micro laser peels how dramatically improved the skin quality and texture is. So absolutely worth it. This is a patient with deeper wrinkles, more sun damage. You can see a lot of lines on her face, and this is after doing skin resurfacing. It's like photoshopping the face. It is absolutely beautiful. And the results, you can see somewhat immediate results even once it's healed within a week to 10 days. But then as time goes on, over 3 weeks and 3 months and 6 months and 12 months, you get more and more stimulation of the collagen, and those collagen fibers really build up and look fantastic. And the results are long lasting. So this may be a procedure, depending on how you take care of your skin afterwards, you may only need to repeat every 10 years or so. Here's another example of a skin rejuvenation, skin resurfacing laser treatment. And here's a very nice, again, dramatic result on fairly deep wrinkles and fairly advanced sun damage. And then take a look at her jowls, take a look at the skin around the eyes, and how all that loose skin has shrunk and tightened. She did not have a facelift. This is just from laser skin resurfacing. Absolutely love this procedure. Here's another example of a patient. Look at her jowls, look at her lip lines, look at all the hooding around the eyes, and of course the skin quality and texture in general, a very dramatic improvement. Here's another example of someone with very deep lines. Look at the hooding around the eyes, the wrinkles all around the mouth area, and it looks like she had a facelift and a peel all at once. Now, in contrast to chemical peels, which can also go deep into the skin, I prefer the laser because it is more precise, and we can more precisely control the depth of the treatment and customize it to what part of the skin we are treating, versus a peel, which is just going to give a blanket, uniform treatment. And then sometimes the peel may go deeper in certain areas, and it's much more difficult to control. So with the laser, there's just a lot more control and a lot more artistry, and we get much better results also in terms of tightening and skin quality improvement. Here's another example of a little lighter resurfacing on someone who does not have as much damage, but you can see a very nice result here. This is somebody who has that rhinophyma, the procedure I was treating at the beginning where I showed you the video. And you can see that we can really sculpt out the nose and get rid of some of that bulky tissue. Here's another example of rhinophyma improvement. And women get this too. So this is a woman with a bulbous nose, and we have seen this in our practice, and we can drastically reduce that and make the skin look so much healthier. So that in a nutshell is the laser skin resurfacing procedure. Now when you come in for this procedure, we recommend and you bring somebody along with you. We will put, depending of course on the extent of the resurfacing, if we're doing a micro laser peel, it's a much gentler procedure. We can usually just do with topical numbing cream. But if we're doing a more aggressive resurfacing to really take years off, then we're going to use a local numbing where I inject the numbing medicine throughout your skin to make you comfortable. And then I recommend that you have someone drive you home, because afterwards there is a significant amount of wound that forms, and you want to be well prepared at home. Make sure that you have soft foods that you can eat. You don't want to eat foods that are going to create a lot of crumbs or that are going to involve you opening your mouth too wide initially. So there is some healing that's involved with this laser, but we get you through that beautifully, and in the end it's really worth it. So that's it. I hope that was informational for you and made sense, and we look forward to being of help to you and keeping you really nice and young and forever beautiful.